Welcome to Dare, the show for startup leaders, innovators, and entrepreneurs who dare to shape the future. Dare is brought to you by the Oregon Entrepreneurs Network, OEN, and Darwaft, the superpower tech team that can make your vision a reality. The Dare Show is excited to welcome Ali Greco to the podcast today. She's a clinical psychologist and user experience leader with a background in anxiety treatment, systems theory, organizational psychology. She's worked in lots of situations, lots of different environments. And she's just launched a company called Parathera, which is an emotional support service for people who need a little bit more than a friend. And her goal is to really expand human connections, especially when things are tough. So, welcome to the show. Great to have you here, Ali.
Thank you, Ned. I'm really happy to be here. I have so much to talk about.
Absolutely. Well, tell us first, how did you get connected to the kind of the startup ecosystem and what's your connection to the startup community?
Yeah, absolutely. So, I've been in Portland for probably 20 years or so. And so I came in during the first wave of .com world in Portland. And so I had some connections also being in the software industry. I had some friends in Portland. And so when I decided to start looking at what to do with Parathera, I went and researched. I went basically onto the social network around in Portland and said, "Hey, I'm thinking about starting a business. How do people in Portland do that?" And so I
Hmm.
got a couple of people who connected me to the startup Slack for Portland. And then from there, just sort of doing my introduction on the Slack was sort of invited to this would have been in January to a meetup of the folks who are in the startup community. And then from there was connected to the Metro Innovation Hub and met with several of their coordinators, and then just started to have all kinds of meetings and things just sort of broke open. And then I did at the end of February, I did a boot camp through the TIE
Hmm.
system, and they did a week long startup boot camp that was extremely helpful. And I met my cohort of other startup folks, and so have been doing informational interviews and been active on the Slack and just really seeing vibrant and helpful the startup community has been. Yeah, I don't think I could have gotten this far this fast without all of the help that I've gotten.
Oh, that's fantastic. Yeah, I really love the startup ecosystem here in Portland because people are really supportive to each other. They're offering resources, they're offering ways to connect, they're offering somebody they know. It's just a really fantastic, supportive community. And it's not very pretentious. People are not full of themselves.
No, I've had one conversation in all of the probably, 20s, of conversations that I've had over the last couple of months where someone needed to ask me questions that I didn't know the answer to. Like, what's the
Uh-huh.
valuation of your idea? And I was like, I have
Yeah.
literally no idea what you're talking about. Everyone else has been super supportive. They want to understand what it is that you're trying to bring to the world. Like, there's this understanding that we aren't doing it to get rich. Maybe that'll happen
Hmm.
and all of us would be supportive
Yeah,
and
it's
proud,
just
but
a happy side effect, right?
exactly. The goal
Yeah,
really, it seems to be to make change and make things better, and everybody seems to want to help people do that.
absolutely. So, speaking of making things better, maybe you could tell us how you're making things better.
Yeah. So Parathera is an idea that I've had for a long time. So when I went through my doctoral training, I was in lots of different work environments. I was in the prison system. I worked with lots of different environments. And then at the end of my training, I worked in community mental health and saw how really important it is that people be connected and have access to support. But it is difficult in our the way that we've structured it in America. It's difficult to get therapy. You have to find a diagnosis, you have to find somebody who will take your insurance. It's expensive. It's often 50 minutes once a week for some ended period of time. And so the
Hmm.
process doesn't always meet the need. And so I went into software, focused on user experience. And then I was director of research and UX for a therapy platform called Sondermind. And in that
Hmm.
work, this was just after COVID, I did a lot of user research into why people were looking for therapy. What is it that they needed from therapy? And a really strong theme emerged that people needed stability and support to get through a life transition. And a lot of
Oh,
people,
interesting.
yeah,
Yeah.
you were seeing that a lot happen in the COVID times because people who had kind of their life figured out got super disrupted. Couldn't go to the gym, you couldn't see the people who you normally use as your support network. Things were legitimately scary, and then we were losing jobs or losing family, and it was a really difficult time
Mhm.
collectively for Americans. And I found that coming out of that, that anytime someone is going through one of those big life transitions, divorce, leaving college is a big one. You lose
Mhm.
the supports from the institution that you were with, and our culture doesn't have those strong supports.
Right.
Finding
Another
and being
another
able to,
transition another transition that's really important is when, and we've seen this a lot in the tech community, is when a major layoff happens, when somebody has spent, 10 years, even 5 years at a company, it's like leaving college. It's a major transition. And a lot of your identity is tied up in what you've done, in the community you've built at work, in the people you know. And so that transition can be a time of major disruption for people, right?
very much so. Yes, you really nailed it in terms of the we all have built up ways that we use to support ourselves as we go through things. And that
Hmm.
social network is really important. And work is a big part of it. We spend so much of our lives there. And when that is disrupted, we have to go and try to figure out how to rebuild that. And right now, one of the only ways to do that is to go to therapy. We don't have a lot of other options. You try to start networking, you're maybe already really tired. You haven't been able to kind of build up from the stress of losing your work, and then finding a job right now is also a very challenging endeavor.
Well, also the thing that I found, because I went through some major transitions over the last few years, the thing that I found in going to therapy as a tech person too was that I had a whole vocabulary around my industry, around the people I worked with, around how that worked, that I had to spend a whole session or two unpacking for my therapist before they actually knew what I was talking about. And it wasn't very helpful. I was like, dude, just understand that, like, if I'm doing these things, I'm progressing. If I'm doing these other things, I'm not progressing. And so it was frustrating because there also some of the common practices. Sorry, I'm just riffing on this, but
Yeah,
some of the
please.
common practices that we see in tech about like relatively brutal feedback in a meeting about code are is pretty standard. Like someone comes in and says, your code is shit, and here's where it sucks, and here's how to improve it. And you're like, thank you so much. I'm going to do that thing. That's received positively in a culture that frankly is pretty male, but is also very focused on mathematics, is not very touchy feely. And so a therapist that I talked to wanted to talk all about that, and I'm like, dude, I'm not going to change the tech culture. I just want to make sure that I'm able to be positive in my next interviews, right? And
Yeah.
so like I felt like I had to coach the therapist how to help me. And so I really feel like you're filling a gap because there are executive coaches and there are therapists, and the executive coaches get things that therapists sometimes don't get, and vice versa. But there's a gap in between for like mid-level people or people who are, really great at working with a team, but don't know how to communicate why that's valuable, or somebody who's really good at going in a cave and generating code, but now is without their tribe. And so they need more assistance there. So that's kind of the work that you're doing to help people in that kind of middle place.
In that middle place. Yeah, what I find interesting is therapy and coaching are really focused on change. There's a goal you meet, you have a regular, treatment plan, you're trying to get to another place. What I'm really focused on is helping someone be stable and use what they already know to get through the life transition, the challenge that, they don't necessarily need change. They need help while they're going through the change. And if they do need some additional insight or deeper work, I am very happy to also have them go to therapy.
Yeah.
But in terms of the
Right. And
goals
so
of therapy,
for example, if you've gone through a big transition, you're missing your team and you want to find a new team, but you don't want to sound desperate. It sounds like you would be a good fit. But if somebody lost their job, lost their marriage, and is in clinical depression, they need a real therapist, right? So there's a difference between like I need to get back on my feet versus I need to get my head kind of straight so I'm not doing harm to myself or others.
right, exactly. I consider there's sort of and I was trained in this, there is a clinical level of intervention. And then there is just a, kind of regular level where same techniques and the same training can be very helpful, but you're not at a place where you necessarily need the level of intervention that you would get from a trained clinician. So, you can be sad and you can have all the normal spectrum of emotions and it not be clinically relevant. It has to do with
Right.
sort of the amount of harm, to use your word, that is happening in your life or to yourself. And so,
Hmm.
if it's not clinically relevant in that it isn't something where you have symptoms and you need to really focus on that kind of remediation. If what it is I'm experiencing life and I'm experiencing all the emotions that go with life, but I myself have skills and coping abilities. And what I really need is for you to help hold me while I get through this. We are
Yeah.
perfect for that.
Got it. And so you said we. So do you have a team with you? Do you like tell me about your group?
Yeah, so right now I am in that process of bringing on contractors, training them. So we have paratherapists is the term that
Hmm.
we use, and the idea being that because what we're looking for is stability, there are some very specific interventions that are things that we can train people to do. And I have a clinical framework that they are trained in, and then specific
Hmm.
ways that they engage with people, and then the way that we do our sessions. We do short 30-minute sessions and we have four different types. And that the session theme gives you an idea of the kind of support you're going to get. So we have a venting session, and that's the one where you really just need to talk about what has happened. So there's something that
Hmm.
you need to get out, you need to process your feelings, but we're not going to be problem solving in that, right? What you need
Hmm.
is to be able to process what happened and talk about it and feel it. In the problem solving session, that's where we're going to be coming together and thinking about what's worked before, what do you need to do that's the next right step. And by separating those out and not just doing 30 minutes of something, you really set expectations up front about what to expect, how best to use that
Mm.
time, and we're much more efficient. And somebody walks away with knowing what it is that we were going to try to accomplish rather than the sort of ambiguous, I'm going to go meet with an
Nebulous.
expert.
Yeah.
I don't know what is going to happen. And so that's really how we get to have someone who doesn't have to go through between, 3 and 10 years of clinical training to be able to, because of the session guidelines and the training that I do, be able to help more people, which is where we're able to be more accessible because it's something that can scale.
Right. That's really fascinating. So I won't ask you the silly question of what's your company valued at, but I will ask you the question of what's your ambition to grow this company and grow this team?
Yeah. I see this as not just a practice. So, what I'm used
Hmm.
to in the mental health world is that you have your therapist or your coach, and maybe you get a group practice, and they can only help the number of people that they can see in the course of a day, which is,
Right.
somewhere between 6 and 8 people. And it just, unless you keep adding therapists, it doesn't grow very well. And so that's where you get sort of the headway where they go and find as many therapists as they possibly can and try to streamline access to them. Where I see Parathera in future is that we are able to hire and train in large cohorts. And because it
Mm.
isn't something that is doesn't require the same level of clinical supervision, is easier for us to then offer lots of sessions and it's a volume play. And so in the future, I'd like this to be national. I would like this to be something that is operating, I think, 24/7 is ultimately my vision, is that whenever you
Hmm.
need, and on demand, really, whenever you need the right kind of support, it's available for you. And that's ultimately where I would like the company to go. So starting very small and like really learning how to do this well, and then figuring out what the scale looks like, because there isn't any reason that we can't make this as big as even international, frankly, because it's a human need and nothing that we're doing would be something that would keep someone from being able to get that kind of support.
So I love that what you said about this being a human need. It's not an executive need, it's not a therapeutic need, it's not a need just for tech workers, it's a human need across the board of people needing a checkpoint or being able to discuss where they're at with somebody else without treating it like I'm in deep despair or deep crisis, but instead, I need to talk to someone who can help me kind of adjust my thinking around this or can help me to transition
Yeah,
through this
exactly.
time.
So
And it may be
reflective
temporary. Yeah.
very much. I think as I envision it now, you could do drop in, whoever's available and meet with someone who is well trained and high quality. And if you choose, you could keep seeing the same person if there is a good rapport and it's somebody you've learned to trust more in sort of the traditional coach or therapy style. But I would want to make it so that it's available and that the consistency of interventions are one that you could come to expect. So people
Right.
know how to do reflective statements, they understand how to do reframing, they understand what it is to give confidence boosts. And so it's important that we get that level of consistency across whoever you work with, but you get the opportunity to sort of pick, is it time based and accessible that's most important to me, or is it relationship based? And I'll wait and see the person who I want to talk to. I want to be able to support both because I think that that is best how people establish trust.
Absolutely. Right. Well, great. Do you have a big vision? You already are working with people. You're already growing your team. So what's your very like next couple milestones that you hope to achieve?
Yeah, we're early on, so I'm still building out the getting the word out and getting enough sessions. So I'm
Yeah.
still in sort of proof of concept and getting more sessions. So I'm putting a lot of my energy into word of mouth, building awareness. That's a big part of it. And then the second piece is the training piece. So I'm
Hmm.
working with a couple of paratherapists in training. And then I've brought on coworker that I had, like a decade ago. He reached out and he
Yeah.
was like, I would really like to partner with you on this, like figure out how to do this. And so he's going to come on board as an advisor and a paratherapist and work. He's in Florida, so he's going to work in a different part of the world and see how what kind of messaging will resonate. He's a military and a nurse by training, and so he has kind of a
Hmm.
different domain of connections. And I'm really interested to see how we might grow those different domains. So another person that I'm working with is younger, and so her network is quite different. And so that's the other piece we're kind of working on is like I can have a specific audience that I'm targeting, and I absolutely do. But bringing on other people in their networks enables us to, I think, adjust to whatever the right messaging is for the right group, and then see if there need to be product changes. I'm very open to
Yeah.
I have these sessions and I have these themes and I'm training to them, but I well aware that this is just where we're starting and that that can change and grow.
So I'd be remiss if I didn't ask about the role of AI in helping people in any capacity. I've seen kind of a surge of people trying to use ChatGPT as a therapist with different levels of success. So I'm
Yeah.
curious if you have a perspective on that.
I absolutely do. So one of the things that I think is people are expressing when they're using ChatGPT for kind of therapeutic stuff is that they are looking for help in the moment when they need it. So the
Mm.
way that we normally think about therapy is that you have your regular time once a week. I do. I'll see my therapist today at 3.
Hmm.
But in between, we don't always have a way of getting the reinforcement, the problem solving, the specific needs that we need. And so people turn to an available source. So I think one of the things about ChatGPT is that it's always there. It's in your phone, it's right there. The other thing I think that people are expressing is that the way that ChatGPT communicates is highly validating. Right now, unless you give it specific instructions, it's going to respond to you in a positive way. It's going to tell you things that that's a great idea, or I really think you're being thoughtful about the thing that you just wrote. Like it is very validating, sometimes maybe a little too much, and it can glaze
Hmm.
you, but that style of communication is something that people really long for, especially when they're trying to be vulnerable. I think the third thing that you'll find with ChatGPT is that it does go out and figure out things that you didn't already know. So I appreciate the reasons that people are using it and actually think that there is valid reasons that you would want that kind of assistance in your pocket when you need it. I think it is extremely good for reminding you of things that you might have learned in therapy but need to be reminded of. So how to do the box breathing that you learned to calm your anxiety, to remember what you talked about in your last session so that that's the thing that's in your mind. I think that there are reasons why it's beneficial. I think the problem is that it's not sufficient. So the
Ah,
way that people actually heal and the way that we move forward in the world is that we get better at being relational with each other. Humans need each other. We need actual warmth. We need real validation. And you can feel the difference when you're looking at something and you have the body language and you hear it in the voice that is
Hmm.
very hard to replicate because we have a subconscious. And I don't think that that's been something that has been played in as people think about the therapeutic benefit of a machine. They're thinking about the theory, the frameworks, the technology, the interventions. They're not thinking
Mm.
about the underlying, more difficult elements of healing that are human to human. And that subconscious and the need for rapport and genuine trust between people is very hard to replicate. And it's even hard for people to quantify. When I look at the research into what therapies are most effective, and you'll hear this a lot with the evidence-based therapies, the research, and this has been true for at least 25 years, if not more, all of the different types of therapy are generally equally effective because the element of sort of action, what makes people get better, is often the relationship with the therapist.
Yeah.
And that is not something that can be genuinely replicated through a machine. Even with an avatar, we're not at that level of connection. And so
Right.
I am pro AI. I want to actually use AI in my training. I'd like to use it in even in potentially during a session to give suggestions to the paratherapist in terms of reminding them about our framework and the interventions that are available to them. Sort of like, I don't know, if you're in a sales call and the salesperson has some suggestions, or you're giving a presentation and it's giving you suggestions on the side. I'd love to use AI for that. But in terms of actually providing the service, I really honestly believe that only humans can do that.
Great. And that's your position at Parathera.
It's my
So
position at
fantastic.
Parathera, which is why we exist. Yeah.
Right. Fantastic. Well, it's been so great to have you on the show. I do have one last question for you, which is what do you dare to dream, Allie?
I dare to dream that every person is able to get exactly the kind of support they need in order to flourish. And it's enormous because of the amount of access difficulties and the amount of trauma and what kind of resources are necessary to make that dream happen. But I want it to be that if you exist on this earth, you are able to find the support you need to flourish.
That's a great dream. Thank you so much. Appreciate you sharing it with us.
Yeah, thank you for having me. I really enjoyed talking with you.
Thanks to our guests today for their insights into the entrepreneurial ecosystem. We wish you all the best in your startup journey. The Dare Show is brought to you by the Oregon Entrepreneurs Network and by Darwaf, the superpower tech team that can make your vision a reality. Visit us at oen.org or at darwaf.io. Thanks again for listening. Till next time.